Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm visiting with you from my Seattle office tonight. Last week I was in Austin when I visited with you, but I'm back in Seattle now. And with me are the two Basenjis. They're hanging out under the desk there. We may see them pop up. They do from time to time. It's good to be with you here tonight. For those of you that are new, I see a number of new names on my board, so I want to welcome you and thank you for being here. The way that you participate in this webinar is two ways. Number one, I'm going to read the questions that people write to me, and I'll give you a response on those questions too. So you can follow along and see what kind of things you pick up that way. The other way you can do this is to write a question to me. And that would be a bold thing to do on your first time here, especially the new people, but go ahead and do it. Give it a try. The way you write a question to me is at the bottom of your screen on the right-hand side, there is a chat box, and you write your question there. The only thing I ask is don't hit the enter key until you're done writing the whole question. So write your question as one big run-on paragraph. You don't have to break it into multiple paragraphs, and click the enter key when it's done, and then send it to me that way. The problem with trying to use your enter key to create paragraphs is it sends separate questions to me, and it gets really hard to piece together what you were trying to say if I have to do that from my side over here. All right. For those of you that are back again, welcome. I'm glad to see a lot of familiar names here tonight, and I think that means you keep getting some value out of it, so I'm glad to see that. So tonight is the second webinar for March. We're going to do a third one next week, and then I'll be off the week after that. So as you know, I usually do 3 in a row and then take a week off. So that's how we'll do it. I plan on being with you an hour and a half this evening. Keep your eyes out on an email tomorrow morning. Where I'll email you letting you know that the recording that we're doing tonight is ready to be viewed. And in that email, I always include a summary of what we talked about so you can see what we did and about where it might show up in the recording. I know I periodically get some questions from you asking if I would timestamp the video, but I hope you understand there's no other staff I have. It's me doing all this work. So I don't go through and timestamp. It's just I try to write a summary so you can kind of figure out from that where it might be within the video if you're trying to get a specific response. The other thing that will be in tomorrow's email is a link to sign up for next week's webinar. So I hope you'll join me then as well too. The thing I ask when I send out those emails tomorrow, feel free to share it with other people. Get this information out. Let know more people what we're up to. And and I hope you'll join me in trying to reach as many people as I possibly can. Okay. All right. So without any further ado, let's go ahead and get started here. Oh, one last thing. I will not be able to answer every question. I try. I work really hard to get through these questions, but if I don't get to your answer, it doesn't mean I avoided it. It just means I didn't get to it, okay? Or to your question and give you an answer, okay? All right, let's go ahead and get started here. Hello, David. Let's see. Hi, Dr. Ross. First off, I want to thank you for all that you do for us Lyme patients. So you're welcome. Let's see. I know you recommend taking a mold binder 30 minutes prior to eating food to activate the gallbladder. I do not have a gallbladder. Should I take the binder 30 minutes prior to eating or take it at the same time along with food? Do people that do not have a gallbladder have more of a difficult time getting rid of mycotoxins? Thanks. So no, they don't have any more of a difficult time, but let me talk about the gallbladder and what it has to mean here. So everyone, there is a condition called mold toxicity, and that occurs in about 25% of all people that have Lyme or don't have Lyme. And it's due to a genetic programming error, if you want to call it that. What happens in 75% of people is we will breathe in a mold toxin from the world around us, and it will get absorbed through our lungs into the bloodstream. And then those toxins in the bloodstream are seen by some of our white blood cells that are programmed correctly, and they put a tag on them. And then other white blood cells come in and break those mold toxins down, and we don't have any more problems with them, okay? But 25% of people, the tagging doesn't take place correctly because the white blood cells aren't programmed correctly. That's the genetic programming area I was telling you about. And so because they don't get tagged, they don't get broken down. And the next line of defense for mold toxins or any kind of fat-based toxin is the liver is supposed to be able to change them from a fat-soluble, fat-dissolved form into a water-soluble form. And then in a water-soluble form, they're supposed to get moved out into the bile system and the gallbladder, where they're going to be stored. And then eventually, when the gallbladder squeezes, it'll squeeze them out into the intestines, and then out in the intestines, because they're still fat soluble and they're not water soluble. They're going to wind up getting reabsorbed back into your bloodstream, because the liver can't make them water soluble. The liver's supposed to try to make them water soluble, but the liver isn't able to. So they go out fat based, and then because they are fat based, out in the intestines, they get reabsorbed again. Okay. So the way that things get out into the intestines is they're either going to drip right through what's known as the bile duct, or if you have a gallbladder, they're going to get stored in the gallbladder and then get squeezed out into the intestines anytime we eat. Okay. All right. So the reason it's an ideal, so when you take your binders, an ideal time to eat is 30 minutes after you take your binders. And that's because when you eat, it causes the gallbladder to contract, squeezing its contents out, including your mold toxins. Okay. And you want it to squeeze out nearest the time when the binder is going by that part of the intestines. And that happens to be about 30 minutes after you eat. Now, if you are don't have a gallbladder, what happens is your toxins don't get stored there. They are constantly being moved from the liver out into the intestines without any relationship to your eating. Okay. And even with the gallbladder, some of them still work out there even without being stored away in the gallbladder too. So those toxins are still going to get bound by your binders. It may be that you need to take your binder twice a day to capture some of those, but they're still going to be bound. And I haven't seen any big difference in people that have a gallbladder and don't have a gallbladder in terms of how quickly they get well and recover from mold toxicity illness. Okay. All right. And let's see. Yeah, I think I answered your questions there. All right. Very good. Thanks, David. Good luck to you. So for those of you that want more background on mold toxicity, including what this thing binders means and what are binders and all that, take a look at my Lyme information site, this Treat Lyme by Marty Ross MD, and look at the online Lyme guide section here. Many of you know this is a website you can find about any piece of information you want about how to manage Lyme disease. I probably have written something about it or have a video about it here. But for the mold toxicity, take a look under my detoxification section here. And then click right here, this mold and Lyme toxin illness. And I'll talk about binders, who gets problems with mold toxicity, etc. Okay? All right. All right. Hello, Lynn. Let's see here. What do you got? Hi, Dr. Ross. I'm taking Mariva 500, 1 pill 2 times per day for inflammation and cytokine reduction. And I would like to add boswelia for more help with arthritis and back pain. I find Advil helps with these pains, but I'd like to avoid taking it long term. Can I take curcumin and boswelia together, or are the mechanisms of action too similar to double up? Is there anything else you can recommend adding to the curcumin for muscular backache caused by SI joint instability and shoulder pain from arthritis? By the way, I do take BPC 157 for the shoulder arthritis and find it helpful. Can all these things be taken long term? All right. So I'm going to answer all that. Okay. So first of all, so the boswelia and Mariva 500. Mariva is a product name for something called curcumin. And curcumin is useful at getting inside white blood cells and limiting the production of inflammation cytokines. Okay. Boswelia, on the other hand, is useful at decreasing the production of inflammatory prostaglandins, a different set of inflammatory chemicals. And there is no harm in taking the two things together. Okay, there's no problem doing that at all. I don't have any problem with people doing that. The BPC 157, for those of you that are not familiar with it, is a peptide therapy, and it's useful at doing a number of things. And in fact, in terms of the various peptides that we can use to do things, we refer to it kind of as the Swiss Army knife. It does a lot of different actions. Okay, so quickly, for those of you that aren't familiar with it, there's a group of chemicals that we make in our bodies. We've determined maybe that there's at least 100 or more peptides that we make naturally. And what distinguishes a peptide from a protein, both are made up of amino acids. The building block for both are amino acids. But if you have 40 or less amino acids, that's a peptide. If you have anything over 40, that becomes a protein. Okay, all right. So there's a number. These are peptides generally are naturally made within us, and there's one made in the stomach lining called BPC 157. And BPC 157 is made in the stomach lining to help maintain good function of the intestines and actually repair injury to the intestines. But it's been discovered that it does a bunch of stuff. All right. So one of the things, a group of people that have found really good use in using it are athletes. They like it because it helps with joint injury, repair, muscle tendon injury, and repair and inflammation. And so it's great at handling inflammation and also doing tissue repair. Okay. It can also do neurologic repair. I've seen it do that. We recognize that it can help balance inflammation in your body. It can make balance something called Th1 and Th2 inflammation in the body, helping your immune system work better, actually. It can support healthy functioning of your mitochondria, your cell energy factories called mitochondria. It can sometimes help with that. And it may even help with something called mast cell stabilization. Sometimes people in Lyme, because of infections and mold toxicity, their allergy cells called mast cells get overly turned on and they start reacting to all kinds of stuff. And BPC 157 may help with that. What probably does a stronger job than BPC 157 in stabilizing your mast cells is actually something called KPV, another peptide called KPV. But to be clear, BPC 157 does a lot of good stuff, all right? Can you mix it with your curcumin? Can you mix it with your boswelia? Absolutely. I have no problem with people doing that. Okay? All right. Thanks for that question, Lynn. Good luck to you. I'm going to do a quick screen share here. So there's a number of peptides that are available orally. I have written an article about that. And let me get over here to it. So if you want to know more about the peptides, take a look at... And actually, I've published an updated version of this as I was getting ready to release my book. This was updated December 17th, and it's the same text that is in my book. All right, so in my Lyme book. But anyhow, I describe what the peptides are: BPC 157, cerebrolysine, something called thymosin beta 4, KPV. KPV is what I like using for mast cell activation. Anyhow, I list them out here, and then down here, I walk through how would you use these, okay? In terms of where you get these peptides, they are also the supplements, and on my store, anyone can order from my store, but if you want to take a look here, you would look under the brand called Integrative Peptides, and these are the various products that they're manufacturing, although they're out of a number of things right now. But I have a good supply of many of these things. Okay. All right. And again, anyone can purchase from here. All right. So let me get rid of that. All right. Hello, David. Let's see. My GP is recommending a colonoscopy. I'm 45 and have some concerns with the sedation they are giving prior to the procedure. I know that the general anesthesia can reactivate Lyme and co-infections. Can the twilight sedation they use for procedure possibly reactivate these infections? So there's an observation that many of us that manage Lyme disease have, that when you get general anesthesia, which is the kind of anesthesia where they put a breathing tube down you and you breathe in anesthetic gas, that general anesthesia seems to reactivate Lyme or cause worsening in Lyme. And often it does, okay? But other types of sedation do not. Okay, so IV sedation, where you get it through your veins. They call it twilighting here. Sometimes they call it conscious sedation. IV sedation of any kind does not seem to reactivate Lyme or cause it to get worse, or any of the co-infections for that matter too. Okay? All right. Good luck to you, David. Thanks for your question. Hello, John. Let's see. Hello, Dr. Ross. Does the Mycopul mold binder have any negative interactions with Viagra Cialis or melatonin? Does it interact with any other meds? Also, can this binder cause any sleep problems or side effects? Lastly, will one pill a day be enough or must do 2 pills a day? Can't seem to find any info regarding this. Questions online and my GP has no idea. Okay. So, as many of you know, I was talking about binders earlier tonight. So binders can bind up, grab hold of mold toxins that work their way into the intestines and keep them from getting reabsorbed. The various things that can be in a binder include charcoal, bentonite clay, zeolite clay, fulvic acid, humic acid, silica, chlorella sometimes can be in binders. And so Mycopul happens to be a version of one binder. It's got a number of things in it. I can show you what's in that here in a minute. But the thing about binders, what I usually have my patients do, whether it's a Mycopul by Research Nutritionals or a similar product, almost the same product, is a product made by Biocidin Botanicals. That's what they call themselves now. And they make a product called GI Detox. They're very similar in terms of what the ingredients are to the Mycopul. What I do with either one of those products is I have patients start at 1 pill 1 time a day. And then after a week, if they're not knocked down from doing that, then I'll have them go up to 2 pills 1 time a day. Okay, that generally is where I start, and I have them do that for a month or two, see how they're doing. If they seem to be handling it well, and we have more work to do on mold toxicity because they're not getting better, then at 1 or 2 months, I might even go up to 2 pills twice a day. Okay, that's what I do. Now, why do I start lower? Well, one thing that happens when you start binding up toxins in your intestines, that causes a void in your blood system because they don't get reabsorbed. So the blood now starts looking like it doesn't have these toxins in it. And toxins that have been stored away in your fat tissues then move into the cells to replace what is not getting reabsorbed. That movement of toxins triggers increased cytokines, right? Now, I haven't talked about cytokines yet tonight, but let me talk about cytokines real quick. And so for those of you who've been here, you've heard me do this spiel many times, but cytokines are really important in Lyme disease. And so what a cytokine is, cytokines are a group of inflammatory chemicals that are made by white blood cells when they see toxins, infections, yeast infections, Lyme infections, et cetera. And their job is to turn on the immune system. And that's really good that we want them to do that. We want them to cause more white blood cells to be made, draw those white blood cells to where the infection is, and help those white blood cells work better. Okay, that's the good part of cytokines. But if the immune system isn't good at getting rid of something like toxins, mold toxins, or Lyme, or Bartonella, or Babesia, it's going to try harder and harder, and eventually it makes too many cytokines. And as you all know, too much of a good thing is not a good thing, or something like that. Okay, so what happens when you get too many cytokines is they give you the symptoms that we identify as Lyme symptoms. So too many cytokines disturb your sleep, interfere with your brain function, so you get brain fog, give you body pain, give you joint pains, interfere with how your hormonal systems work. Essentially, the symptoms that we call, and they even give you fatigue, they can suppress the immune system. So the symptoms we call Lyme symptoms are really excess cytokine symptoms, okay? And these cytokines are also triggered by a movement of mold, or of mold toxins in your body. Okay, so that's why when you start pulling them out with binders, that movement of toxins, as I was just describing, will trigger more cytokines to be made. All right. So what you can do is start slow. Just start at 1 pill a day. And if you don't get increased cytokine symptoms, then after a week, go up to 2 pills 1 time a day. Okay, that's how I wind up doing it. In terms of interacting with medicines, the one thing you want to do, there is no direct interaction with Viagra Cialis other than there is the possibility with any medication that these binders would bind that medication, right? So in terms of timing of when to take your binders, I advise that my patients stop their medicines and supplements about 30 minutes before they take the binder and then resume taking them about 2 hours later. Okay, so there's a 2.5 hour window around that begins 30 minutes before you take your binder and ends 2 hours after you take your binder that you are at risk of binding other things. So you just want to avoid taking those other things at the same time. So that's your medicines and your supplements, okay? And then, but food, again, you can eat anytime, although the ideal time would be 30 minutes after you have your binder, because that is when eating causes your, if you, let me do this again. So you would want to eat about 30 minutes after you take your binder, because that causes the gallbladder to contract, squeezing stuff out so the binder can grab hold of it when it goes by that part of the intestines. Okay. All right. So I think we got everything covered for you there. Yeah. All right. Good luck to you, John. Hello, Jim. Let's see. Hi, Dr. Ross. Thanks for these great webinars. You're welcome. Let's see. Do you think Chinese medicine and or aromatherapy can be helpful in treating Lyme and co-infections? If so, in what ways do you see them being helpful? All right. So, yes, I do. I'm not so sure about the aromatherapy. I do think aromatherapy, for instance, if you're breathing in lavender steam or lavender oil, that can make you sleepy, which can be helpful in Lyme, obviously. I'm not aware of other forms of aromatherapy that would help, though. Okay. Chinese medicine, by Chinese medicine, you can mean one of two things. You can mean acupuncture, or you can mean doing Chinese herbal medicine. I find both can be helpful for people with Lyme. And I use it more to complement and help. I like acupuncture, especially when I got people with pain syndromes that I'm not getting much benefit from in terms of using the curcumins that I recommend and treating infections and getting sleep. Especially with the pain syndromes, I may wind up using acupuncture or Chinese herbs, okay? I also like using acupuncture Chinese herbs. If I've got somebody that's got a lot of allergic and sensitivities, I sometimes will get them involved to help me with that. And I also like using, for people that have a lot of fatigue, that's not budging with treatment, I sometimes will use the Chinese medicine or acupuncture for that as well, too. Okay. All right. If you're looking for a good Japanese style acupuncturist here in the Seattle area, who I tend to refer people to, is a really great acupuncturist named Randy Clare. He's just north of the city up in the Shoreline area, but does a great job. And he's who I use for my acupuncture as well, too, when I need help with things, too. All right. All right. Good luck. Thanks, Jim. Hello, Jackie. Let's see. Hi, Dr. Marty. Have you seen neurologic symptoms with severe intestinal yeast overgrowth? I've had burning redness in the hands and feet, sharp stabbing pain, and constant tinnitus for 10 years. More recently, muscle twitching in the head, hands, thumbs, forearms. My neurologist found nothing despite extensive testing. In addition, chronic constant lower abdominal bloating. Have you seen these symptoms subside with treatment? Can menses make yeast worse? Any advice on causes and how to alleviate? I've been treated for Lyme, BART, mold, and heavy metals. Thank you. All right. So in my experience, if you get too many yeast living in the intestines, it can lead to a lot of different things. Okay. So first of all, if you have too many yeast in your intestines, the white blood cells are going to see them and they're going to try to get rid of those yeast and they're going to make cytokines, right? So too many yeast in the intestines give you all those excess cytokine symptoms I was telling you about earlier. So hard thinking, fatigue, body pains, body aches. Okay. So it can do those. All right. Sometimes the cytokines can trigger some neurologic dysfunction. But the other thing I think that happens with too many yeast, we know that they release toxins. And I have seen that as we treat intestinal yeast, a lot of the neurologic symptoms that people have can get better, sometimes go away, by treating yeast too. And I think that's for two reasons. You lower your cytokines, but also I think you get rid of the neurotoxins that yeast can release as well that get absorbed into the bloodstream, okay? So could yeast be part of this or all of this? Maybe. Could be. The only way to know is see if you have too many yeast in your intestines and then treat it. In terms of trying to figure out if you have too many yeast, start thinking a person might have too many yeast if they've got a lot of sugar cravings, increased intestinal gasiness or bloating, and females having repeat vaginal yeast infections means you probably have too many in your intestines as well too. And the other thing, these toxins that I was telling you about that get released, in addition to being neurotoxins, can interact with the skin in some people and give worsened skin rashes and even pimples and acne, okay? So if you have a number of those things going on, think intestinal yeast overgrowth. If you have never treated for intestinal yeast overgrowth, there's a good screening tool I have that you ask a bunch of questions about risk factors and symptoms. And if you score over 140, that means you probably have yeast. Now, if you have treated for intestinal yeast before, you may still score over 140 in the screening questionnaire because part of the questions are historical. They're not going to change even after you get the yeast out. So just keep that in mind, okay? I'll show you where that questionnaire is. I'll show you two articles. One is on how do you treat yeast, and the other one is how do you diagnose yeast, okay? So let me do a screen share here. All right, so take a look over here at my yeast section, okay? And then to see if you have enough symptoms or to even look at my questionnaire, take a look at this chapter here called A Silent Problem. Is it yeast? Or this article here. And somewhere down here, if you just click on this link right here, it'll pull up my yeast questionnaire for you, okay? And then in terms of how do you treat too many yeast, I've got a number of herbal and prescription options in this article too. Okay. All right. All right. Thanks for your question, Jackie. Good luck to you. All right. Hold on here just a minute, everyone. Hello, Christine. Let's see, hi, Dr. Ross. Thank you for your research. You're welcome. I'm diagnosed with Lyme and Bartonella by genetics and on several different antibiotics since last May. Now I want to switch to herbals, primarily have headaches on the right side and neck pain on the right, both of which are getting better, going from a 10 to about 1 on the pain scale. What do you suggest? Thank you. All right. So if you need to get an idea of what's still present. Okay, do you still have active Bartonella or did they get rid of it? It could be what's left is all Lyme. Okay, so so on average, Bartonella requires about 4 to 6 months of antibiotics that target it. And you can clear Bartonella, okay, more easily in most people, I think, than you can clear Lyme, okay? And so it's about 85% of the time, within 4 to 6 months of treating for Bartonella, you can get rid of it. Lyme, on the other hand, and the reason Bartonella does tend to respond a bit easier in Lyme is it replicates more quickly. In fact, Bartonella replicates about every 24 hours. And so it regrows pretty quickly, and things that grow quickly respond more quickly to antibiotics, okay? Versus Lyme can replicate much more slowly. By some estimates, maybe every 4 weeks it replicates, okay? And so it takes longer to get rid of. An average length of time to get rid of chronic Lyme is about 1 to 2 years. So it's possible at this point, if you've treated for 6 months or longer, that maybe your Bartonella is gone, okay? So what you need to do, there is not a good test that we can do, blood test that we can do that says, where are you in your Bartonella treatment? Are you done? Is it going away? We don't have such tests, okay? But you can look at symptoms. So you need to look back at what were your Bartonella symptoms to begin with and what's happened with them, okay? So let me talk about what I consider to be Bartonella symptoms, because there's an overlap here, okay? But some things that are more specific for Bartonella than for Lyme would be having a lot of pain on the balls of your feet, having a sense of internal buzzing or vibrating, so no one else can see it, but you feel it. Having a severe neurologic symptoms of neuropathy, tremors or shakes, seizure-type disorders, having bad anxiety, ongoing anxiety, for instance, or depression can sometimes be part of Bartonella. Bartonella can give air hunger. It make you feel like you can't get enough air in from time to time. And then sometimes people with Bartonella have these rashes that look like scratch or stretch marks. And although sometimes those don't go away with treatment, you should not be getting any new ones, okay? So, and then finally, Bartonella can give just some of the most severe cognitive impairment. Lyme can give some too, but Bartonella gives severe. So look at that list of symptoms that I just gave you and look and see which ones did you have originally. Have a lot of those gotten better? If they have, you're probably done treating Bartonella and you can focus more on just treating Lyme, okay? So, and you might talk to your physician about that to have them help you figure that out as well too, okay? But in terms of what I would use, if this remains mainly to be Lyme, and you want to go herbal in terms of your antibiotics, I would look at using cat's claw and something called Otoba. Those two herbs have been studied and found to be very effective at removing biofilm from Lyme, but also from treating growing Lyme and treating the forms of growing Lyme. So growing Lyme exist as a spirochete that looks like a corkscrew. They also can live in a microscopic cyst form, okay? And they can live inside of cells too. So I have found them to be effective at all forms, okay? More recent research shows that the cat's claw can treat persister forms of Lyme or persister state of Lyme, okay? So let me do Lyme terminology 101 here because these are all confusing terms, okay? So Lyme has certain appearances and then Lyme has two different growth states, growing or hibernating, we call those persisters, okay? So the forms, what the germ can look like as a corkscrew, that's called a spirochete. They can morph from the spirochete into these little microscopic balls called cysts, okay? And then they can also move inside of cells. They shed their coat and they just live inside cells without a coat. Now, we know from laboratory evidence that the spirochete and the cysts can either be growing or hibernating. I have no idea whether intracellular Lyme hibernates. No one's done that study that I've been able to look at and figure that out. Maybe they do, maybe they don't. I don't know, okay? These hibernators or persisters are catching everyone's attention the last 4 or 5 years, and we're wondering if it's these persisters that explains why a lot of people aren't recovering. That's the current in vogue idea. Many of us are doing things to try to treat persisters, and I do build treatments I do have things in my treatments that deal with persisters, okay? So in your in this cat's claw Otoba regimen, cat's claw may handle your persisters, all right? But in addition to that, to especially get at the persisters, in addition to doing Otoba and cat's claw, I'd like to also have people take something called liposomal cinnamon, clove, and oregano, 1 pill 2 times a day. Those volatile oils in there are very useful at removing biofilm, slime layer that can cover the germs. And they can also treat persister and growing Lyme. So my go-to treatment these days, herbal, if I'm going to do an all herbal regimen for Lyme, is cat's claw, Otoba, cinnamon, clove, oregano capsules, okay? So of the liposomal cinnamon, clove, oregano capsules, you do 1 pill twice a day. For the Otoba and the cat's claw, I usually have people start at 5 to 10 drops twice a day, and then increase every day by 1 drop per dose until you reach 30 drops twice a day. And then in terms of going up on the dose, if you're in the middle of it, let's say you're at 20 drops twice a day and you suddenly start getting a herx, you feel worse, then I tell people to delay increase, still stay on it. Don't stop taking it, but delay the increase until that has passed. So that's the nice thing about herbal antibiotics as well too. Okay. I give the herbal antibiotic regimen like this about equal chance that I do with the Lyme prescription antibiotics working. Okay. All right. Now, if for some reason you still have Bartonella, after you kind of ascertain that, the cinnamon, clove, oregano can help with Bartonella, can help growing and persistent Bartonella. In addition, though, I probably would add, what I do with my patients is I have them take something called Sida acuta and also another herb called Houttuynia. That's HouttuYnia. And that you dose the same way that you're dosing the Otoba and the Casclaw. You start at 5 to 10 drops twice a day and then increase every day as you can. You tolerate up to 30 drops twice a day. Okay. So if you want to see more information about these, what I just outlined with you here, let me do a quick screen share for you. Okay, so take a look at my Lyme protocol. And this is a protocol for chronic Lyme disease, all right? And in this protocol, I address a good treatment should deal with sleep, things, diet, cytokines, being on something to help deal with the stress called an adaptogen, support your hormones, be on a good multivitamin, do some detox steps, exercise. The whole protocol actually boosts the immune system, get yeast out if it's there, and then treat your Lyme infection. Okay, so down here in this section 11, I give you some ideas on how to start treating. So number one, you could do an all herbal protocol, and that would be the Otoba, cat's claw, cinnamon, clove, oregano. And I talk about how to do that there. Okay, and then for your Bartonella, you would find that down here in section 12. And again, there's a whole supplement herbal way of doing it, and I list that here. That's the Houttuynia, Sida acuta, cinnamon, clove, oregano. The Sida acuta, I dose it two ways. I either work it up to 30 drops twice a day, or the way that Buhner used to do it, as in Buhner herbs, and I have that way listed here, is to do a quarter teaspoon 3 times a day for a week, then bump up to a half teaspoon 3 times a day. So you can do it either one of those ways. Okay. All right. And one last thing, if you're looking for a source for these herbal antibiotics, take a look under what I'm recommending these days. I really like their product, is this company called Montana Pharmacy. They're up in the far northwest side of Montana, almost near the Canadian border, and kind of a nice group. I've actually enjoyed working with them over this last year, and I'm finding their products to be really good. They're made kind of using a Buhner type approach, in terms of they're made with 1 part of plant put into 5 parts of alcohol, and an extraction is done with that. Okay, but you'll find a whole array of herbal antibiotics here, including the Houttuynia I was telling you about. Here's the Otoba bark, cat's claws in here someplace too. Okay, anyhow. And again, anyone can buy from my store, so feel free. If you're looking for a source, a good quality product, I would recommend this brand. Okay. All right. Thanks, Christine. Good luck to you. Oh, there's one other thing I should show you, in case you didn't quite follow all those symptoms of Bartonella to track. Go back to my information site. And there's a section here I have called How to Diagnose. And take a look here at the How to Diagnose Bartonella and Chronic Lyme. And in here, I do list out the symptoms that you would want to follow. Okay? All right. All right. Thanks for your question, Christine. Hello, Lynn. Let's see, Dr. Ross. I keep hearing that chronic infections can lead to Th2 dominance, but I'm wondering what causes Th1 dominance And how would someone know if they have it? Are there symptoms or tests that would be diagnostic or raise one's suspicions of Th1 dominance? So, I haven't found any reliable blood testing that tells me for sure whether when someone's Th1 or Th2 dominant. I'm not aware of an accurate way of testing for that. Okay. We know from research that when people have a hard time getting over infections, that in all likelihood there is a switch Th2 dominance. And so when I have people with chronic Lyme, and they're having a hard time getting better, I assume there's probably some degree of that. But I don't have a way of really testing for it, unfortunately. Okay. All right. Sorry about that, Lynn. Good luck to you. Oh, if you all want to know ways you can change that dominance, one thing that you can use to try to rebalance Th1 and Th2 is, so Th1, everyone, would be made up of cells that fight infections, okay? White blood cells that attack germs. So you'd be your macrophages, your neutrophils, things that actually just attack the germ, okay? All right. Your T cells, okay? Th2, so you kind of think of Th1 as being your offensive squad. They're out there attacking at germs, okay? Th2 is more of what I would call your defensive squad. It's made up of your white blood cells called B cells that make antibodies. So it makes circulating antibodies that are supposed to kind of grab hold of a germ if it breaks through, okay? They're also made up of your allergy cells called mast cells are part of this too, okay? And some of your autoimmune cells are autoimmune illness are part of Th2. That is also coupled together with something called Th17. Th17 would be the type of white blood cells that line your mucous membranes and right underneath your skin that will catch a germ that it has never seen before. They don't even have to identify that germ as ever having been in you before. And they do certain things to unidentified germs right away, okay? So the imbalance that people often get is Th2, Th17 are too high, and then not enough Th1. What happens in this situation is that Th2, Th17 releases cytokines that suppress your ability for Th1 to work. Okay, that's what the theory is. Okay, all right. Now, what regulates these levels, the parent in the room, is something that's supposed to be called a T regulatory cell. All right, so kind of think of it as the mom or dad. That these are the kids, and it's the parents that are supposed to kind of get these kids in balance again. So the approach. One of the approaches when you have a lot of Th2 versus Th1 is to try to upregulate your Tregs, okay? And what is useful at doing that, there's a couple ways to do it. One is to work with low-dose naltrexone. So low-dose naltrexone, many of you may be familiar with, is a medicine we use for people with narcotic overdoses. So our body has a natural narcotic system made up of something called endorphins. And we have endorphin receptors, and the naltrexone, being a narcotic blocker, binds to our endorphin receptors, basically, okay? Now, the endorphins we make, in addition to helping with pain, regulate the immune system too. So what happens with low-dose naltrexone is when you, we call it low because naltrexone is manufactured as a 50 milligram pill. But when we use it for this purpose, we use it anywhere from 1.5 to 4.5 milligrams. And at that dose, it will bind to these endorphin receptors for maybe 4 to 6 hours and then wear off, okay? And we want it to wear off. So while those endorphin receptors are bound, there's a few things that happen. Number one, the endorphin receptors become super sensitive to any endorphins that are out there. And secondly, the brain does not like the fact that these endorphin receptors have been blocked, and it starts sending out a bunch of signals to the endorphin producing cells in the body to make more endorphins. So what happens then is at 4 to 6 hours, as these endorphin receptors get unblocked, they get flooded with excess endorphins, and they're super sensitive to those endorphins. And that has an effect of causing more T regulatory cells to be made, which then can balance out Th2 versus Th1. Okay, that's one thing it does. All right. Second thing that, and so it can help with, especially people that have developed a lot of autoimmune illness, that can help with that. The other thing it does, there's a type of receptor in your brain, type of cell called microglia, and they have a type of receptor called a toll receptor. And if those toll receptors are blocked by naltrexone, and they can be, that can change pain regulation in the body. And so one thing that has been shown is that blocking those microglia with low-dose naltrexone is very useful for fibromyalgia type pain. Okay, so the myalgia that you get in fibromyalgia, that muscle achiness, and that we get in Lyme, the low-dose naltrexone may be able to help with that. And then finally, low-dose naltrexone is as the naltrexone will bind to what are called toll receptors on your mast cells, your allergy cells, all right? And bound to those toll receptors on your allergy cells, your mast cells, turns down the hyperactivity of these mast cells. And so it can be useful as a way of regulating mast cell activation syndrome that happens in Lyme disease as well, too. Okay, all right. So I'll show you the article on that. Okay, so one way to regulate these, increase the Tregs and create balance in Th2, Th17 versus Th1 is low-dose naltrexone. All right. Another way is to use a peptide product, and that is a product made by integrated peptides called Thymogen A1, and it's got a number of peptides in it that are designed to basically T-regulate cells and get better balance between Th1 and Th2. Okay. The trouble is that product is out right now. It's not clear to me when they're going to have it back in stock again, but the low-dose naltrexone is available to anyone that can get a physician to write them a prescription on it. Okay. All right. So let me do a quick screen share here. All right. So take a look at, you can just put LDN here in the title. And this is my article on low-dose naltrexone. I talk about how to dose it. I talk about side effects, which are really minimal. And then I talk about what it does. Okay. All right. Okay. Thanks for the question, Lynn. Hello, Karen. Let's see if we can stump the doctor. You might be able to, as you know, periodically I do get stumped here, but give it a try, Karen. Let's see what you got here. Let's see. Are you familiar with the co-infections that are less well known, as in Funiformis mosei or Pneumocystis jirovecii? No, I'm not familiar with those. You have stumped me. And I haven't even seen anyone discussing those, to be quite honest with you. I'll have to look into that. So you've stumped me. Thanks, Karen. All right. You know, the thing that's nice about this forum, because you all have to live with such a horrible illness, right? Many of you are constantly searching out new information, and sometimes you find things before I find it. But the benefit is you bring it to my attention, and then I look into it. And there's been numerous times that I have used ideas that I got here that you all introduced me to, that I've incorporated into my practice, and have found it helpful. And in fact, in my book, my new book, in the forward section here of it, in my dedication section, part of that dedication is to you all, okay? And so what I said here is, to participants in my live Lyme disease question and answer webinars, thank you for challenging me to dig deeper on the way to finding solutions. This book includes some ideas you brought to my attention. So I even put it in the book, all right? So yeah, and about my book, I think many of you know, I have published a book that is made up about 40 articles that you can find at Treat Lyme, edited, compiled, cleaned up. It's very useful with all my antibiotic protocols. It has information about various alternative medicine treatments, my review of them, whether I think they're useful or not, and how you would use them, for instance. It has in it a background section about some key things you should know before you begin treating. For instance, that On average, for Lyme, it takes a year to get well. It reviews what to do to protect your gut microbiome so that you don't get destruction of that while you're treating Lyme. And it also talks about what to do if you have failed treatment before. I have a whole chapter on that reviews reasons that your treatment might have failed. Okay. It's got a section here with the yeast questionnaire. It's got a review of some key antibiotics like disulfiram, dapsone. There are sections there on that as well too. And then it's got some other key articles in it like low-dose naltrexone, how to use peptides, why you would use peptides, what to do about mast cell activation, how do you lower cytokines, key articles in there about that as well too. Okay. You can find this at my supplement store or you can find it at Amazon, either way. But if you're looking for something that has a lot of this information that I'm showing you here tonight, get the book. Obviously, you can also read it online, but sometimes it's easier to read it in the book too. All right. So anyhow, that's my book. Okay. All right. And then, yeah, thank you. Thanks for that question. Thanks for stumping me. I'll have to take a look at these. Hello, Laura. Let's see, Dr. Ross. I've tried multiple rounds of herbal antibiotics over the years to treat Lyme and Bartonella. I think it's come the time to look into IV antibiotics. At what point would you suggest that a patient take a closer look at IV antibiotics? Which IV antibiotic would you recommend for Lyme, for Bartonella, for Babesia? Thank you for all you do. So before I go to IV, I would wind up looking at oral antibiotics, prescription antibiotics. You've mentioned doing herbal antibiotics over the years. But, my experience is herbal antibiotics for Lyme work about 90% of the time, but they don't work in everyone, right? And for Bartonella, herbal antibiotics work about 75% of the time. And for Babesia, they work about 80 to 85% of the time. So the next step before jumping to IV antibiotics might be to looking at doing prescription pill forms of antibiotics. I generally avoid IV antibiotics. There's reasons for that. Number one, cost. Insurance these days is just not good at covering long-term antibiotics for Lyme disease. And so you can be out, thousands of dollars for doing it. The second reason I don't like using IV antibiotics is I give them maybe about a 5% better chance than the orals that they're going to work. But there's a lot of risk involved. Okay. So the risk is financial. I already talked about that. Second risk, though, is you have to have an IV line left in, something called a PICC line, or if you put it in the big arteries up here in your chest, we call that a central line. But those lines have risk. And about 15-20% of the time, over a 6-month period of time, we got to pull them out because you developed a problem. The two biggest problems can be that at the tip of the IV line, sometimes small blood clots can form that then break off, float down into your lungs and kill off part of your lungs. We call that a pulmonary embolism, okay? Or even though people do a great job trying to keep these things sterile, there's always the risk of getting infection in your bloodstream through that line, all right? And about 50% of the time, we got to pull those things out. So I'm not sure that's worth all that risk. My recommendations when I hit this point with my patients is not IV, is to go with the oral antibiotic regimens, okay? So, and then in terms of, good IV antibiotics for these different things, for Lyme, a good IV antibiotic can be Rocephin, also known as ceftriaxone, but azithromycin can do well. Doxycycline can do well. You can do those IV. Bartonella, rifampin can sometimes be a good IV antibiotic. Babesia, our better agents for Babesia are oral. They're not IV. In fact, I've never done an IV antibiotic for Babesia before. All right. Good luck to you, Laura. Thanks for the question. Hello, Mary. Let's see, Dr. Ross. Thank you for taking my question. I am currently on Rocephin, which is ceftriaxone. Okay, so it's an IV antibiotic, Biaxin, and atovaquone for treatment of Lyme, Bartonella, and Babesia. I'm also taking liposomal cinnamon, clove, and oregano. I decided to not add Levaquin, which I asked last week because of the interaction with Biaxin. How do you feel adding rifampin instead of Levaquin as a treatment for the Bartonella? I am concerned the rifampin can change the effectiveness of atovaquone. I have not had success with doxycycline or Bactrim in the past. Thanks, Mary. All right. So if we look at your current treatment and what's doing what here. So the Rocephin is treating spirochete Lyme that lives outside of cells. It may pick up the cyst Lyme. There's some conflicting data on that, okay? All right. The Biaxin is going to be picking up intracellular Lyme. And so that would be your Lyme treatment, okay? The thing you're missing here for a Lyme treatment is you're not taking anything that deals with cyst Lyme here, all right? Remember, Lyme has different appearances, all right? It's possible the cinnamon clove oregano might probably does pick up cysts, but in terms of prescriptions, you don't have it, okay? All right, the cinnamon clove oregano you have here for the Lyme infection is useful for treating growing Lyme as well as persistent Lyme. So between Rocephin, Biaxin, cinnamon clove oregano, you've got Lyme covered pretty good. The only thing you might be missing, maybe cyst coverage, but pretty good, okay? All right, for Bartonella, you've got coverage with the Biaxin and the cinnamon clove oregano, especially cinnamon clove oregano is going to be going after your growing and persister forms or state, and the Biaxin is going to be going after growing. It doesn't do anything for persisters, okay? And then for Babesia, you have a good treatment with the Biaxin atovaquone. That's a good treatment, okay? So you got yourself covered pretty well here. If you were to make the Bartonella treatment stronger, you could do an IV rifampin or an oral rifampin. You could do either one of those, okay? I'd probably go with oral. The problem with rifampin is it can lead to liver inflammation. Atovaquone can sometimes lead to liver inflammation, and Rocephin can sometimes lead to liver inflammation. Also, atovaquone, I believe, Rocephin, I think, decreases drug levels of the atovaquone. Let me just double check that real quick. I'm just looking at my drug directory here, so hold on here a minute. Okay. I'm getting there. Huh. It's interesting. I'm looking in, I thought there was an interaction between the two, but I'm looking in the rifampin directory and I'm looking at atovaquone so I'm in the rifampin and I'm looking at what does it interact with. And I'm trying to see if they even have atovaquone in here. Oh, yeah, there it is. Okay, there it is. Found it. All right. Avoid combo. Combo may increase rifampin levels and may decrease atovaquone levels. Okay. So, if you do your rifampin at 600 milligrams a day, you still have ample room. You could increase it even if that combination increased the rifampin. It wouldn't hurt you to go a little higher, that the atovaquone would cause higher levels of that, okay? The atovaquone going lower, so if you find that you're using rifampin and that the symptoms of your babesia start returning, then you'd start taking more atovaquone, okay? So you overcome the problem that can be caused by putting you on that combination. So that could be a way of addressing it as well too, okay? Yeah. So it isn't that it makes atovaquone less effective. It just means that you may have to put more in you to overcome the increased metabolism created by being on rifampin, okay? All right. Oh, the other thing I should mention, I think that I use rifampin as my anti-cyst agent. Remember I said I think you may be a little weak on the cyst side of treating Lyme here. Two ways you can make a stronger rifampin can do that. And then also grapefruit seed extract is an herbal medicine. Grapefruit seed extract, 250 milligrams, one pill 2 times a day. Okay. All right. Good luck to you, Mary. Hello, Doug. Yeah, Dr. Ross. Thank you. My questions are, do you treat Babesia for 6 weeks? And if so, do you do azithromycin and 5 days on and 5 days off? And you've got a second part to your question here. Another question I have is, can you take methylene blue, azithromycin, and low dose naltrexone together at the same time? All right, let me go to your first part here. So, Babesia, for acute Babesia, you might be able to get by with 6 weeks, but when you have you've been chronically ill, most of us don't think 6 weeks is going to be enough. And generally what we try to, so Babesia, keep in mind, lives in your red blood cells, all right? And red blood cells have a life cycle of about 3 to 4 months, right? So they're naturally going to die. And what we have found is it's most useful to treat through one life cycle length of red blood cells. And I think what happens is if you're on your anti-Babesia medicines, and they may or may not be killing the Babesia in your living blood cells, but or they may kill them in living blood cells, but you don't want to reseed the growing new blood cells, basically. So I usually try to treat my chronic Babesia patients about 4 months to 5 months. I find that most effective. But if this is from the tick bite you just got 2 days ago and you have Babesia symptoms, often in those situations, treating for 6 weeks may be enough in those situations. Okay, you just got to guide by what your symptoms tell you. All right. In terms of pulsing, so azithromycin. So first of all, azithromycin, you mentioned, and if so, do you do azithromycin with 5 days on, 5 days off? So if you're doing azithromycin by itself, that's not going to be adequate for Babesia. I assume you're probably doing either atovaquone or something called malarone, which is atovaquone with proquinol in it, as another drug that you're using to treat your Babesia. I don't find pulsing azithromycin to be that useful because azithromycin has a very long half-life. It takes about 7 days after you stop it for it to get out of your system. So all that you're doing is still in you. You're not getting the benefit of pulsing because the drug never goes away really during that time period. But I find treatments are more effective if you use your azithromycin daily, actually. Okay? All right. Thanks for your question, Doug. And then your other question is, can you take methylene blue, azithromycin, low dose naltrexone all at the same time? In my practice, I do. I don't have any difficulty with that with patients, or have I seen any problems develop from doing that? Okay. All right. All right. Let's see here. Hello, Gemma. Let's see here. Dear Dr. Ross, I hope you can offer some insight on this, as I really trust your opinion. I hope I can. Let's see. I'm treating Bart and Babesia, and my protocol has just been switched from doxy, rifampin, clarithromycin, and malarone to Bactrim, rifampin, clarithromycin, malarone, and cryptolepis. I'm nervous as it seems an awful lot, and I hurt terribly when starting new drugs. Is this amount of drugs usual in treating Lyme and co-infections? All right. So in terms of the protocol that you're switching to, let's see, I've just been switched from doctor malarone to, okay, so Bactrim and rifampin would wind up treating, those two together are along with, well, actually, Bactrim, rifampin, clarithromycin, all three of those can address Bartonella. Okay. The clarithromycin coupled with rifampin can be a full Lyme treatment. And then your malarone, cryptolepis, clarithromycin, and maybe the Bactrim are things that you can do to treat Babesia. The cryptolepis also can help with Bartonella as well too. Now, cryptolepis, we historically have thought as being an herb that only treats Babesia, but what we know from research published about a year ago is that cryptolepis is really quite useful against Bartonella and Lyme too, and it also will treat growing and persister forms, okay? So I would admit, I think this looks like a lot of things. You probably should bring that up with your provider and say, is there a way we can scale this back? One way that you could scale this back, but again, you should talk to your physician. I'm not your doctor, okay? I don't know all the ins and outs of why they came up with this, but a way that you could look at changing this would be get off of the Bactrim. I think that's one thing that is an extra drug that you may not necessarily need. And then the rest of it, I think, would be fine. Anyhow, but talk that over with your doctors, okay? I don't understand their full rationale for what they're doing here, okay? All right. Good luck to you, Joe. Hello, Sita. Let's see. Is there a proven cure for chalazions and styes? My warm water and salt don't seem to be helping. Thank you. So chalazions and styes are things that you develop up here on the inside of your eyelid, or actually along the eyelid, I should say. And they're basically from blocked pores, oil pores along these areas. And the idea of using the warm water and salt is to help bring those things out, okay? If you keep getting those a lot, sometimes what's helpful is to actually to take Johnson's baby shampoo, put a little bit of water, and once a day, like when you're showering, just put them up in this area, just wipe it in here. So Johnson's is non-tearing, you're not going to cry from it, okay? But the shampoo actually helps break up the oils and everything. It keeps blocking the pores so they're not going to get infected, basically. And you can do that as a daily thing, as a preventive, okay? All right. Good luck to you. Hello, Esther. Let's see. Hello, Dr. Ross. Thank you for so much for the wonderful and insightful webinars. You're welcome. Let's see. You are the best. Oh, thanks again. Yep. My chronic disease doctor recently wanted me to do a COVID long haul blood test because I have had COVID twice last year and I reacted poorly to the Moderna vaccine in 2021 with horrible fatigue and brain fog. The panel showed elevated IL-4, IL-6, IL-10, IL-13, CD40L, CC, etc., and VEGF. The doctor says it's hard to differentiate whether this is secondary to chronic Lyme or chronic COVID. They want me to take Maraviric, which is very expensive, atorvastatin, fluvoxamine, low histamine diet plus Zyrtec and famotidine. I would like your opinion whether you would have one of your patients take any or all of these meds on a guess. I'm currently seeing a naturopath and being treated for Lyme and co-infections. I have been implementing your protocol for BART on my own for the last 2 months. Thank you kindly. Okay. So, I think he looks at that. I don't know if I'm going to be able to answer this fully for you. So there is a physician named Patterson, Bruce Patterson, that has come up with a theory for both long COVID and for Lyme that basically, especially in long COVID, that this spike protein that is made by COVID, that your white blood cells are unable to break it down. And that leads them to stay chronically inflamed. For that, there is a certain cytokine pattern, and you've listed out these various cytokines here that one would have, okay? In addition, he postulates that there is also a cytokine fingerprint that you will have when you have activated chronic Lyme. And supposedly, he says, based on his research, that certain patterns of elevation of these cytokines can indicate either COVID or can indicate chronic Lyme. Okay, now, without being able to see the actual elevations that you have in the patterns here, I can't tell from what you just listed here whether it says chronic COVID or chronic Lyme to me. I just don't know. Okay. The other thing I want you to postulate with you is that Dr. Patterson's work has not been validated by any other doctor. He's done it himself. He developed the science, and you always got to be concerned about people that advocate for something that they're the only person that did. All right. So the other thing he did with his research is he's shown that Miraviric, which is an HIV antiviral, and atorvastatin, which is a statin for lowering cholesterol, the two of those together through various ways can help clear that spike protein, get inflammation under control, and he contends that it might even be helpful in chronic Lyme. Now, the problem with his theory in chronic Lyme is I think he misses the part that in some people, the reason they're still sick is they have chronic infection. I think he thinks that in chronic Lyme that this inflammation is just chronically turned on, and you can get it to turn down using the Miraviric and the atorvastatin. His theory about whether Miraviric and atorvastatin would work in COVID, I think if you have a hard time clearing the spike protein, I think the theory makes sense, but I don't think it's been adequately validated by anyone but him. Okay. My experience that I have seen with my patients that have had getting this testing done and then let him interpret it, I don't interpret it, is that I have seen about 40% or so get some improvement doing the Miraviric and atorvastatin if they have COVID. I'm not so sure that I'm seeing major improvements on my patients that have chronic Lyme for that chronic Lyme side of things here. All right. So that's my take on it. I don't know enough about you to say whether this is truly a good idea or not. And I don't have the actual test results that I can look at to see which categories you would fall into, whether you have the pattern that fits a chronic COVID, long haul COVID, or a chronic Lyme. I just don't know from what you've written here, so I can't make more comment than that. Okay. All right. Good luck, Yasser. Hello, Dave. Dave asks, hey, Dr. Ross, thanks for all of your time and dedication to us Lyme patients. You're welcome. My question for you today is, number one, where do we send ticks we find on us to be tested for one or more of the Lyme germs? Is there more than one quality lab to send this bug to? Number two, if bitten, what do you recommend for prophylactic treatment to try to prevent BB from taking a foothold in our bodies if present in the tick? Okay. So, I'm not a big believer in sending ticks to be tested. And the reason is they sometimes will miss the infection. They don't always pick it up. And so because of that, I usually don't, and I don't want to wait the length of time it might take to get the test results back to start antibiotics. Okay. So I have written a whole article about, and so I don't know what the labs would be. I don't know where. I know you can send it. IGeneX has the ability to do it, but there are other places you can send it. But I'm not going to base treatment upon whether it's there or not. I'm going to base it on my clinical suspicion, to be quite honest with you. Okay. So there is an article that I have written. I'm just going to walk you through it here. Okay, so up here, acute tick bite. Here is my article. Okay, so what I want to let you know is it's kind of complicated to decide if you want to treat. And the decision to treat is based upon what kind of a tick bit you. So the only tick that transmits Lyme is a black-legged deer tick. Okay. And the main thing that we try to use antibiotics to keep you from getting is Lyme. On the other hand, the infections of Bartonella, Babesia, Anaplasma, etc., generally, if Lyme is not present, are easily handled with antibiotics, and we don't tend to prophylact for them. Okay. So in making a decision about whether you should get treated, if it's asymptomatic, if you don't have any symptoms that suggest Lyme, you make a decision about whether to treat based on whether you're in an area that may have a lot of ticks with Lyme, okay, and that's the key part of the decision, okay, all right. If you have symptoms like fever, rash, etc., you should treat with antibiotics, okay. All right, so I review all this here, but in the end, the antibiotic you want to use if you don't have any symptoms at all, and if you live in an area that tends to be a higher risk for having ticks, would be, and if it's a black-legged tick, would be to use doxycycline for at least 20 days. Doxycycline is the best antibiotic for situations like this, okay? All right. So take a look here. You'll see the whole article I read. I give you the information so you can consider it yourself. Take a look at this article, okay? Thanks for your question, Dave. Good luck to you. Hello, Catherine. Let's see. Hello, Dr. Marty Ross. I am IgM positive for BART, Borrelia, and tick-borne relapsing fever. I'm trying to start either minnow or doxy, and each time I begin, my small joints and fingers become severely inflamed, very red and arthritic, and they don't seem to resolve with detox. Also, I am unable to take hydroxychloroquine due to issues with eyes, and I'm not sure how to treat my infections without destroying my joints due to the awful inflammation. I am following all the protocols for cytokines, including detox procedures and IV glutathione, but inflammation is so severe and does not resolve. Do you have any suggestions? Is this a sign the antibiotics are working? Would it be okay to incorporate a steroid while trying to treat and control the inflammation? Also, for arthritis type symptoms with antibiotic, would have strongest anti-inflammatory effect. Oh, also for arthritis type symptoms, what antibiotic? Okay, so believe it or not, your strongest anti-inflammatory antibiotics would be the tetracycline, so doxy or minnow. Also, the clarithromycin, azithromycin have some anti-inflammatory properties as well too. So we know when you start killing germs and you get worse with pain or fatigue, that usually means you're having a Herxheimer reaction. I know you know that, but I'm just stating the obvious here. And a Herxheimer reaction is due to the immune system seeing the dead bug parts and making more cytokines. Okay. In terms of controlling cytokines, glutathione is helpful, like you've mentioned, but also being on curcumin can make a big difference. And you may be on it, you just didn't list it here, so I'm going to state that. I'll run my curcumin up to 1,000 milligrams 3 times a day, okay? And I will also do glutathione either as an IV up to 1,200 milligrams 3 times a week. I'm sorry, 2,500 milligrams 3 times a week. Or I'm going to do liposomal glutathione like a Trifortify orange or Trifortify watermelon by Research Nutritionals as 1 teaspoon twice a day. All right. But even so, if somebody still is having a really, really tough time, instead of using the full dose of the doxycycline at 100 milligrams twice a day, I might back down and do 50 milligrams twice a day. So you can use a lower starting dose on your antibiotics and up it as you can handle it. Okay? All right. All right. Good luck to you, Catherine. Okay, everyone, in terms of recommendations on how to manage a Herx, take a look at my online information site and then take a look at this section called Herxheimer and Cytokines. And here's the article called Herxheimer die-off reaction inflammation run amok. Okay, all right. So take a look through here. You're going to see which supplements I recommend, which is the curcumin and possibly glutathione. There's a few other ideas here too. Okay. All right. All right. Let's see here. Hello, Lean. Let's see. I have looked at your list of antibiotic herbal supplement combinations you recommend. Do you need to take them all at the same time or can you take them sequentially? I ask because my nephew cannot do IV ceftriaxone right away, but could start on the other 2 oral med supplements you recommend right away. Thanks. I'm not quite sure what you're asking here, but what I'm going to do, I'll show you my protocol and I'll talk you through it here. Let's see. Okay, so depending on what infections you have, so if you have Lyme infection, what I recommend from an herbal standpoint would be to take Otoba, cat's claw, cinnamon clove, oregano combination all at the same time. Okay, meaning on the same day. These are twice a day. This is twice a day. You take them at the same time. Or you could do this, my prescription supplement option, which would be to use doxycycline or clarithromycin at the same time you take either rifampin, rifabutin, tinidazole, grapefruit seed extract. At the same time you take liposomal cinnamon clove oregano combination. Okay, so you would do those all at the same time. And if you happen to have Bartonella or Babesia at the same time, you're taking everything you did for Lyme, you would follow one of these recommendations, either the supplement recommendation or, excuse me, the prescription recommendations that I have. Okay. I hope that answers your question. I'm not sure I clearly understand your question, but I hope that answers it for you. Okay. Excuse me, everybody here. All right, let's see here. Thanks for that question. Good luck to you. Hello, Caitlin. Let's see. Can Bartonella be the cause of swallowing difficulties? I've had positive tests for Lyme and Babesia and black mold. I started treating Bart with Cellcore and noticing some improvements. I'm also passing parasites. I've been struggling with swallowing for over a year now, and it's by far my most concerning symptom, and I want to know where my treatment focus should be. Okay, so first of all, I hope you've had an evaluation of that. So probably something called a swallowing study, and then an ear, nose, and throat doctor or gastroenterologist looking down to see if they see any anatomical problems, okay? And if not, you should talk to your doctor about getting that done. But of the tick-borne infections, could Bartonella be a cause of this? Yeah. So Bartonella can cause neurologic dysfunction, and it could be affecting the nerves that regulate and control a person's ability to swallow. So it is possible that it could be part of that. Yep. Okay. All right. Good luck to you, Caitlin. Hello, Caitlin again. Let's see. I was bit by a tick a few years ago and have had a headache since that day. I also had a fever upon getting bit. I have had a whole lot of issues, but Babesia is still showing up on my test and the IgM. Doctor says this doesn't mean the infection is still active and no need to treat. Can you explain this a bit more? I'm just wondering if I should treat or not. I have oxygen drops, anemia, air hunger, trouble swallowing, headaches, etc. So I would probably need to ask you a lot more questions, but I'll just make a few comments. Okay. So whenever we get testing, whenever we get testing that says positive, we have to look at the person and try to figure out, even the test is positive, is it real? Okay. Could you have false positive? And the chances of a test showing up positive being accurate in predicting that you still have that current problem goes up with the amount of symptoms you have of that illness. Okay. So symptoms that I look at that are very suggestive of Babesia are having drenching night sweats, maybe once or twice a week, having a lot of frontal headaches in the front of your head, having air hunger, feeling like you can't get enough air from time to time, having Babesia gives some people get very frequent deja vu experiences when they have it. So if you have frequent deja vu experiences, that can sometimes be part of it. And then Babesia can give you a lot of dysregulation between your adrenaline and anti-adrenaline systems. So people will have a difficulty with heart skipping and racing periodically, or they get lightheaded quite often easily whenever they stand up. Okay. So if you have a lot of those symptoms, a number or a lot of those symptoms, and you have a positive IgM or IgG Babesia test, my inclination in those situations is to treat. Okay. But again, I agree with your provider. A positive test doesn't necessarily mean you have the problem. You got to see, does the clinical symptoms fit that problem too? Okay. All right. Good luck to you, Caitlin. Hello, Margot. Let's see. Good evening, Dr. Ross. Thank you for consistently delivering exceptional help. You're welcome. I have started oregano, cinnamon, and clove with a lot of gains. Does lumbar kinase help Bartonella? Do you sell it in your supplement store? So yeah, lumbar kinase can help. So lumbar kinase, everyone, is a group of enzymes that come from the skin of earthworms. You gotta love this crazy illness. Some of the things that we have to resort to is earthworm therapy, basically, right? But anyhow, what lumbar kinase is good at doing is it breaks down a protein found in your blood called fibrin. Fibrin is found as part of blood clots. So fibrin circulates in your blood and is ready to be used to make blood clots, basically, right? But there is some evidence that with both Babesia and with Bartonella, that those germs have an ability to wrap themselves and attach them to the fibrin, and they form these little nest of germs and fibrin all woven together, and then they stick themselves on the blood vessel wall. And there, it's hard for the immune system to get the germs, and it's hard to get antibiotics in, okay? So what can make a difference is lumbar kinase can be used to break those down. I used to start everyone at 1 16 milligram pill a day. I'm sorry, twice a day. And I learned to back down. I've seen some impressive Herxheimer reactions. So generally in my practice, when I'm going to use a lumbar kinase, I'm going to start at 1 pill a day. And after a week or so, if somebody's not herxing badly from it, then I go up to 1 pill twice a day. Okay. You can even advance it all the way up to 2 pills twice a day, but usually 1 pill twice a day is where I end with most of my patients. There's 2 brands that I carry. One is an allergy research product, which is 16 milligrams per pill. And then there's a company called Canada RNA that makes a product called Baluki, which is also lumbar kinase. It's a 20 milligram pill. It's a bit more expensive than the allergy research, although allergy research has had a price hike. We'll have to look at that together here in a second. But I tend to use the allergy research because historically it's been a little bit cheaper than what the Baluki product is. And I don't find really much of a difference between 20 milligram and 16 milligrams because there are different strengths on those brands. Okay, 20 milligram is the Baluki and 16 milligram is the allergy research product one. Okay, so let me just do a quick screen share here for you. And yeah, both my protocol for my Lyme and my Bartonella, for my Babesia and my Bartonella both call for adding lumbar kinase into those treatments because of these fibrin nests, okay? All right, so in terms of, I'm just going to show you this real quick. So in terms of Babesia and Bartonella treatment, for Bartonella, article is called Kills Bartonella Brief Guide. And one of the things you're going to see is I talk about these right up here at the top. I talk about Bartonella fibrin nest, okay? That's what I was just describing to you. And because of that, in my protocol, I wind up recommending, where is it here? Step 4, remove Bartonella fibrin nest with lumbar kinase. Okay, so there it is right there. Okay. All right, and then in terms of lumbar kinase, so there's 2 brands I carry. All right. And so there's the allergy research product. That's a 16 milligram pill. I sell 60 capsules for $87.92. Oh, it's increased in price. It's getting closer to what the Beluki is. Beluki is $92.86 for 60 capsules. Okay, so there's a little bit of a price break, not as much as it used to be. Allergy Research just raised their prices, and I had to raise mine because of it then too. Yeah, anyhow, the Beluki comes in a 120 capsule bottle and a 60 capsule bottle too. Okay, anyhow, any of these would be fine for you though. Okay. All right. Oh, one word I just want to make here. On my store, just the prices that I have, I sell at the minimum amount allowed by the manufacturers. If I could go lower, I would, but I can't because when I've done that before, they've threatened to pull my ability to sell their products. Okay, so I'm selling at the lowest amount that they will allow me to. But to make it more affordable for you, if you buy more than $50 of supplements from me, I'll pay for your shipping. Okay. And the other thing I do to make it more affordable for anyone that buys from my store is I pick up state and local taxes. I don't charge you those. I still have to pay them, but I don't charge you those. So that's one thing, another way that I try to make these things a bit more affordable for you. Okay. All right. Margo, thanks for your question. And, everyone, thanks for being here tonight. I'm going to have to wrap up here and get on to feeding and walking Tubus-Singes. Yeah, they used to hop out here a lot during the webinar. I don't know if many of you were around when they used to do that, but my dogs are getting old. One of them is 15, the other one's 14 now, and they tend to spend most of these webinars now sleeping below me here. So anyhow, keep your eyes out on your email tomorrow morning. I hope to have everything wrapped up and to you before 9 to 9:30 a.m. in the morning. And in that email, when you get it, will be a link so you can sign up for next week's webinar. And then also in that email will be a summary of what we talked about tonight too. Okay. All right. I'd appreciate it if you'd share all this information. And when you get that email, send it out to anyone else you think that may benefit. And I look forward to seeing you all next week. Thanks for being here tonight. Good night, everyone.